And welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about consumer protections as we move into the brave new world of expanded healthcare insurance, medical insurance here in the state of California. My guest is Bill Monning, a member of the State Senate from Carmel. Thanks for being with us.
Thank you, Steve. Pleasure to join you.
So let's sort of start at the beginning and back up. California is moving quite aggressively to implement the Affordable Care Act. The exchange is being set up, and a number of bills are going through the process to do all of that. We will see expanded options clearly under the Affordable Care Act, and I guess you've got some concerns about one of those options, that some of the health and wellness programs that may be coming out.
That's correct. So the big picture, Affordable Care Act implementation, California is moving forward aggressively, as you indicated. As soon as October of this year, we'll start enrolling people in the medical exchange. But one of the specific issues, the Affordable Care Act, President Obama very much wants to use health reform to promote health, to get more at the front end, supporting prevention programs, immunization. One of those elements is encouraging workplace wellness programs and creating incentives for employees working with employers and health insurance companies to build into the workplace more healthful options and encouragements. And
in theory, that's a very good
idea.
Great. That's all great. You want to get people, preventive health care, so they don't go to the emergency room, which is very costly, of course. Whenever they get sick, you want them to learn about some of the preventable diseases, heart disease, things like obesity, things like that.
Right. So I fully support that direction that President Obama is leading the country. The challenge, and what I try to address in Senate Bill 189, is that we don't want the unintended consequence of somebody in a workplace whose employer offers a wellness incentive to be penalized because of a pre-existing health condition. They may be overweight due to prescribed medication that their doctor has given them to treat diabetes. So not every employee comes to the table with a similar health history or with the ability to achieve certain health outcomes. So our focus is to say we want to encourage participation in healthful lifestyles, gym memberships, walking, weight reduction if appropriate, but we want to be cautious not to penalize an employee because of a pre-existing condition, or we don't. My bill would also say you can't adjust premium payments based on health outcomes.
So you're talking about premium payments or co-pays, for example.
Correct.
What about adjusting premium payments or co-pays based not on health outcomes, but on participation, whether you participate in this wellness program?
Well, that gets us half the way there, I think. So my bill, we want to encourage participation. When you look at peer-reviewed health journals, the most effective programs at the workplace have been where participation is rewarded, but there's different ways to reward participation. I would argue it should not be through changing the premium payment for somebody who participates or who can or adjust their copay, because not everyone comes to the workplace with the same health history or the same ability. Say a single mom with 3 kids who has to take the bus to pick up her kids at the end of the workday versus a 20-something male who can go to the gym every day at 5 o'clock at the end of work. Not everyone's coming to the participation option equally. We just want to say encourage participation, reward it with bonuses, but not at the point of premium payment or co-payment.
All right. Well, interesting subject. We'll certainly watch the progress of your legislation as we move forward. Thank you very much, Senator Monning, for being here.
Steve, thank you.
And thanks to our viewers for watching Local Edition on Time Warner Cable. A reminder, you can watch this and other interviews on My Government On Demand, also on YouTube.